Yes, good evening. Good evening, everyone. This is Dr. Abhijeet, and welcome to yet another session of Head and Neck, where I will be discussing the osteology of maxilla, osteology of the frontal bone, and the osteology of the zygomatic bone today. So, yes, Osama Sheikh, good evening. Xavier, hello. Yes, I'm very much fine. Rohit Kumar, hello. Hello, beta. So before starting the session, guys, just give me a thumbs up in the chat box if the audio and visuals are perfectly fine and like you all can hear me out over here, right? So I just want your yeah, yes. Lignesh MP, hi beta, hi, hi. So yes. So I will be discussing the osteology of maxilla, osteology of the frontal bone, and the zygomatic bone. Rohit Kumar, done, done. Okay, Lignesh, yes, I'm BDS. Yes, beta, you have to know this. Anand Koluri, hi, hi, beta. What about rest, guys? I hope everyone can hear me. I'm audible, right? So shall I start the session, guys? Just give me a thumbs up in the chat box if you all are ready with your notebooks. Yeah, sure. Very good. I hope everything goes good, right? So let us now. Yes, Prashant Singh, you should join this session because the anatomy remains the same. Anatomy absolutely remains the same for everything, right? It doesn't changes, guys, right? You have to study the entire head and neck anatomy, and if you're starting with osteology, it will be like favoring you. If you like start from the crisp, basic, okay, from the scratch, you will be like benefiting a lot, right? So yes. Now, let us discuss about the frontal bone, guys. Right now, let us discuss about the frontal bone. And guys, you already know the one that is marked in the orange over here, right? The one that is marked in the orange over here. You already know this is the anterior view. This is the anterior view, guys, right? And over here, you can very well identify this is the frontal bone. This is the frontal bone. Now, guys, can you identify which bone is this? The other things will become like way easy. Okay, let me mark this as 1. Let me mark this as 2. Which bone is this? Right? You are going to tell me which bones are these. Yes, I will be like giving you the notes. Anyone in the chat box which would like to comment which bone is this? And the third one, which bone is this? Yes, Ankita Gain. Yes, very good. One, it is the zygomatic bone. Very, very good, Peter. It is the zygomatic bone. Zygomatic bone, right? You already know the third, we have the maxilla. Maxilla. I'm like pointing out these bones, guys, because they are in relation to the frontal bone over here. Yes, okay. Osama has given zygomatic. Second one, yes, Osama, you are right. It is the nasal bone. Yes, it is the nasal bone. It is the nasal bone, beta. It is the nasal bone. Yes, Ankita, Osama, Rohit, very good. Lignesh MP, very, very good, beta. Right, 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 right. Now, over here, good day, sir. Promise from Nigeria. Okay, Nigeria. Okay, perfect, perfect, Peter. Over here, guys, if you can just like mention over here, we are going to start our discussion with the frontal bone. We are going to start our discussion with the frontal bone. And remember, guys, that let us first. I've taken out this frontal bone over here. This is the frontal bone, and I have taken it out over here. So we are going to discuss this frontal bone osteology right now. Frontal bone osteology right now. Right now, let us just try to start our discussion with the frontal bone, and you guys already know that frontal bone, it is a thin, you can very well see from the appearance, guys, it is curved, right? It is curved. So the frontal bone, it is thin, curved, bony plate, right? It is thin, curved, bony plate. You already know it comes under the category of flat bone. Okay, and inside the frontal bone, guys, you guys will be finding, or it lodges, the frontal air sinuses. Frontal ear sinuses, right? Now these frontal ear sinuses, they are also classified under pneumatic bones. It can be also called as the pneumatic bone because it is containing the frontal ear sinuses. Now guys, when I say flat bone guys, you already know the flat bone is the one which is protecting an organ. For example, the sternum is a flat bone and it is protecting one of the organ known as the heart, okay, the lungs, right? Now guys, you're going to tell me in the chat box, this frontal flat bone, I mean it's a flat bone, it is protecting which organ in our body? Yes, it is protecting which organ in our body? Okay, so yes, I'm waiting for your, I will be like telling you each and everything, no need to worry better over here. Firstly, I'll be focusing on the bone today. Yes, half a series, Ankita, very good. It is protecting the brain wala part, right? You already know, guys, that this frontal bone, it is situated in the forehead region. It is situated in, no, it basically comes from the word frons. Frons basically means the forehead only. Okay, frons basically means the forehead only. Shakil Ahmed, Ram, very good. Osama, very good. So it is situated in the forehead region. It is situated in the forehead region, right? So yes, remember, even we have like three fossas, guys. Okay, anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. We have three fossas that are present, and remember, the anterior cranial fossa, the anterior cranial fossa is largely contributed by frontal bone, largely contributed by frontal bone. Okay, so these are the basic points, guys, that you have to remember in case of frontal bone. These are the basic points that you have to remember in case of frontal bones. Now, basically, this was the introduction part, guys. Now, coming on to the parts of the frontal bone. Now, this is something which, like, you already know the introduction we have discussed. The introduction, the general points. Whenever you describe the bone, you have to tell about the first thing, that is the general points. Okay, the general points or the introduction wala part. Now, the second part comes where we are going to discuss about the parts of the frontal bone. Parts of frontal bone. Now guys, let us just try to understand what are the different parts of the frontal bone. Now guys, the okay. Now guys, you already know we have a main part of the frontal bone, this curved like part, this entire curved like part. That is called as the squamous part of the frontal bone. This is called as the squamous part of the frontal bone. Squamous part of the frontal bone, this curved like part which you can see, and guys, you can see it is maximum in area. It is maximum in area. That is why guys, remember the squamous part, it is also known as the main part of the frontal bone. So the very first part that we have to discuss, it is the squamous part. It is the squamous part of the frontal bone, right? Squamous part, right? So basically it is the part which is forming the forehead. It is the main part of the frontal bone which is forming the forehead. It is the main part which is forming the forehead. Now guys, the second part that you have to like remember over here, we also have something called as the nasal part, guys. Okay, we have the nasal part, and let us just try to see over here also. If you can just see the one which is like above the nasal bones, right? Above the nasal bones, these are the nasal bones, right? And the part of the frontal bone which is like above the nasal part, it is the nasal above the nasal bones. It is basically the nasal part, right? So yes, we have the nasal parts, the nasal part. Now guys, if you just try to focus over here in this particular picture, we have the part of the this part which I'm highlighting, guys. This is the part which is like forming the orbital part. which is forming the orbit, guys. So this is the part of the frontal bone which is forming this particular orbit, right? So that is why this is called as the orbital part of the frontal bone. This is called as the orbital part of the frontal bone because it is forming the orbit of the frontal bone, right? So the third one, remember guys, we have the orbital part, and you guys are going to tell me how many orbital part, or I can simply say the orbital plates. How many orbital plates will be there? Chalo. Squamous part is one, the nasal part is one, but how many orbital plates will be there? And I'm waiting for your answers in the chat box. Chalo. And guys, yes. Ankita Gayan, very good. It is two. Osama, very good. We have like two orbital plates, which you can very well focus over here also. This part beta. This is the orbital plate, right? So that is something you guys already know. This is the orbital plate, which you can like focus over here, right? Now guys. Yes, Milan, Shakil, Ram, Promise, very good beta. Now, so we have the two orbital parts. Can you see guys these projections? Any part of the bone which is coming out, which is projecting from the body, right? You have your own body and a part of the upper limb is coming out, like your arm, your upper limb is coming out. This is called as process. This is called as process. And I hope you can very well appreciate that this is one of the process and this is one of the process. Can anyone tell me the name of this process, guys? Can anyone tell me the name of this process in the chat box? Yes, Dr. Mehnaz, hello beta. Shahidur Rahman, very good. Can anyone tell me the name of this process over here? Beta, you already know below we have the zygomatic bone. That's why it's very essential to know the underlying bones also, right? So this will be nothing but the zygomatic process of, yes, this will be the zygomatic process. Very good. Yes, Sahidur, very good. Zygomatic process. बेटा it will be the zygomatic process of frontal bone. बेटा bone का नाम है frontal. तो इसकी process जो zygomatic bone के साथ articulate करती है, that will be named as zygomatic process of frontal bone. Okay, Osama? Try to name it just based on the articulation below, right? Just based on the articulation below, right? So we have, yes, the orbital plates, which are 2 in number. We have the zygomatic process. Can anyone tell me the number of the zygomatic process? Yes, we have the zygomatic process. And remember guys, these are again 2 in number. These are again 2 in number. Now, in between the two orbital plates, guys, can you just see this particular notch? This notch, guys, when I've taken this frontal bone out, and I'm just trying to see that between these two orbital plates, this notch, okay, this U-shaped notch, it is, yes, Ankita, Shakil, Osama, very good. Lumbai, Shahidur Rahman, very good. This notch, which is basically lodging the ethmoid bone, over here ethmoid bone is present. This is a U-shaped notch that is called as the ethmoidal notch. That is called as the ethmoidal notch. That is called as ethmoidal notch. So the fifth part that you have to just mention, in between the two orbital plates, we have a U-shaped notch, and that is called as a ethmoidal notch. Ethmoidal notch. So where in this notch, which one will be there? It will lodging the ethmoid bone. Okay, it lodges the ethmoid bone. So I hope till now the introduction and the parts are clear. The introduction and the parts are clear. Just give me a thumbs up in the chat box, guys, if it is clear to each one of you. If it is clear to each one of you. चलो फटाफट से thumbs up दे दो chat box में. Now beta, let us just try to focus on the squamous part of the frontal bone, right? हाँ बेटा अभी सारे पढ़ेंगे सारे. Dr. Mehnaz, okay. Shakil, Ram, Hafiz, Lignesh, Shahidur Rahman, very good, very good. I will be discussing, guys, each part separately, so no need to worry. Shahidur Rahman, very good. we'll be discussing each part separately, right? So let us first try to discuss the squamous part, that is the main part of the frontal bone. Okay, that forms the forehead. Let us just try to see the ethmoidal vessels and nerves, everything we are going to discuss better. No need to worry. बिल्कुल भी चिंता करने की जरूरत नहीं है. We'll be discussing each part independently, right? All the nerves, arteries, muscles I will be like teaching you. Let us now first focus on the ethmoidal part, the squamous part of the frontal bone. The squamous part of frontal bone. Again, these lectures are for the first year, guys, because I personally believe you guys don't know from the scratch and frontal bone, right? Now, let us guys just try to draw this. What do you think? Let us just try to draw this so that you guys are like very much aware. Okay, let me just try to draw this, guys. I will be trying to draw a very rough diagram, a very like a schematic line diagram, which will be like more like easy for you to remember also, so that you all have this basic idea that yes. No. Now guys, just try to see. I will be like comparing it with that particular bone as well. So I've not drawn it in middle, and let us just try to, yeah, draw it a bit nicely, guys. Otherwise you will think sir is drawing something. Okay, and that is, yeah. Now guys, okay, let us just try to mark some important structures over here. What all we can see. Now guys, the squamous part of the frontal bone, guys, has an external surface. एक surface जो बाहर आप देख पा रहे हो, this surface which I am highlighting, guys, this is called as the external surface of the frontal bone. Yes, this Sudhanshu, hello. This is the external surface of the frontal bone, right? External surface is the part which will form the forehead, beta. The external surface forms the forehead. Now, अगर ये एक फ्लैट बोन है, अगर हमारे पास एक्सटर्नल सरफेस है, फॉर एग्जांपल लेट अस अस्यूम दिस इज द एक्सटर्नल सरफेस, तो एक इंटरनल सरफेस भी होगा क्योंकि वो एक फ्लैट बोन है. कोई भी चीज अगर फ्लैट है, इफ इट इज फ्लैट, इट विल बी हैविंग टू सरफेसेस, एक बाहर वाला और एक अंदर वाला. So one which you can see outside, guys, the one which you can see outside, it is the external surface, and we will also have the internal surface. And you guys already know, inside the surface, guys, what will be present, guys? It will lodging the part of the brain that is called as the frontal lobes. ठीक है, frontal lobes, right? If you can just see over here, guys, that ये तो बाहर वाला सरफेस हो गया, that is the external surface which forms the forehead. और इसी forehead का ये जो अंदर की तरफ होगा, guys, इंटरनल सरफेस में आप लोग को ब्रेन का कौन सा पार्ट दिखेगा? दैट इज यस, यू ऑलरेडी नो, वी विल हैव द frontal lobes, right? Now guys, if I just want to appreciate, there is this border, guys. Can you appreciate this border, everyone? Anyone can appreciate this bone? It is the parietal bone. Parietal bone. And frontal bone, it is joining with the parietal bone with the help of a border over here. And can anyone tell me the name of this border, guys? This suture, actually, between the frontal and the parietal bone, this suture which divides it into anterior part and posterior part, right? Yes beta, it is for the first year student. Yes, Sahidur Rahman, of course. Yes, it is coronoid. नहीं, अंकिता नहीं, it is Virish Ramanwar. Okay, it is coronal. Ram Rohit. Yes, it is the coronal suture beta. Frontal और parietal के बीच में coronal होता है. Remember beta, we have discussed. Yes, we have discussed a plane, guys, that is called as the coronal plane, which divides the body into anterior and posterior part. Body को ऐसे काटोगे तो body को एक आगे वाला हिस्सा, that is the anterior part, और एक पीछे वाला हिस्सा, that is the posterior part में divide करेगी. Shakil, very good guys. So guys, if you can just appreciate guys, this will be the parietal border, I can say, or if it is from anterior to posterior guys, आगे से पीछे देख रहे हैं तो ये पीछे parietal bone की तरफ है. So I can simply say the posterior border of the squamous part, or I can say the parietal border. So remember, we have the posterior border, okay, or parietal border. Now this border, guys, if you already know, it articulates with, yes, one of the bones. It articulates with parietal bone, and you already know the answer guys. It articulates with the parietal bone to form the, yes, the coronal suture, to form the coronal suture, right, to form the coronal suture, right. Now let us first try to see in the picture over here, and then we'll come to the part also. Now guys, if you can see at the junction of, now guys, just try to see this picture everyone. I hope everyone can appreciate guys that this is the zygomatic process, and yes, you already know this is the parietal border or the posterior border. This is the squamous part. Now we are discussing the squamous part, and you can just see at the junction of the anterior surface and the orbital plate. बेटा ये नीचे orbital plate है, ये नीचे orbital plate है, ठीक है. We will find a margin guys, that is called as the superior orbital margin. This is called as the superior orbital margin. Very important. Superior orbital margin. We will find a superior orbital margin right over here. Now I hope everyone can appreciate over here. Now guys, you already know कि body का midline is over here only. Body का midline is over here only, and on the sides it will be the lateral part, right? We will have from medial to lateral, we have like two sides over here, right? We'll have two sides over here. Now guys, you guys are going to tell me, I am dividing this part into two. I'm dividing it into, yes, this line into medial 1/3, and we will have lateral 2/3. If I divide this line into two parts, medial 1/3 and lateral 2/3, and at the junction of the medial 1/3 and lateral 2/3, you will guys get a foramen over here, a hole over here. If you can appreciate guys, a hole at the junction of this superior orbital margin, we have an opening or a hole over here. And remember guys, this is called as the supraorbital notch or foramen. It is called as supra, देखो orbit के ऊपर है, supraorbital हो गया, supraorbital notch, और इसी को हम लोग क्या बोलते हैं, supraorbital foramen. This is called as supraorbital notch, or it is also called as supraorbital foramen. अब obvious सी बात है कि ये एक गड्ढा दिख रहा है, तुम्हें एक space दिख रहा है guys. So what will pass through this? You already know we will have the supraorbital nerves and supraorbital vessels. Now when I say vessels guys, I'm talking about the arteries and the veins. So supraorbital nerve, supraorbital artery, supraorbital vein will be like passing through this particular notch, will be passing through this particular notch. Is this clear to everyone over here in the chat box? Just give me a thumbs up कि बेटा ये चीज समझ में आई कि स्क्वामस पार्ट का जो आगे वाला पार्ट है, एंटीरियर पार्ट है, और ऑर्बिटल प्लेट, उनका जो मार्जिन है, दैट इज कॉल्ड एज द सुपीरियर ऑर्बिटल मार्जिन, एंड The superior orbital margin, basically at the junction of medial 1/3 and lateral 2/3, basically we have a notch or foramen that is called as the supraorbital notch, और उसी में से पास करती है supraorbital nerves and vessels. Yes, Ram, Hafiz, Shakil. What about rest, guys? What about rest? Please try to give me a thumbs up in the chat box. Yes. So I hope you all can appreciate over here. You all can appreciate over here. If you just want, we can like draw also. Yes, please just try to draw this as well, so that you have a clear idea, guys. Right? You have a clear idea, right? Okay. And yes, I'm just trying to make it very simple, guys. The squamous part, right? The squamous part. Yes, Shakil, Virish, Lumbai. Yes, promise. Very good. Yes. Now, guys, over here, if you can just appreciate, guys, this is the zygomatic process which I have drawn, and this is, yes, the supraorbital margin. Supraorbital margin. And you guys can very well appreciate over here that this is the supraorbital foramen. Please write down all the structures over here. It is the supraorbital foramen, and from here what will pass? The supraorbital nerve and vessels. Nerve and vessels. Now when I say vessels, it is arteries and veins both. Arteries and veins both, right? So it is at the junction of, guys, you already know, this is yes, the medial 1/3, and yes, we have the lateral 1/3. नीचे तो आप लोग को पता ही है, we have this, yes, the orbital plates, right? The orbital plates, the two orbital plates. चलो इतना क्लियर हो गया सब लोग को, इतना क्लियर हो गया सब लोग, ठीक है? Now lateral end of this margin, guys, if you can just see over here, if we talk about this particular end, this particular end, guys, will be forming the zygomatic process. Yes, Kailash, very good. It will form the zygomatic process. Okay, and this zygomatic process, देखो squamous part का ही part है. We have the zygomatic process, guys, right? And the tip of the zygomatic process, of frontal bone, and the tip will be articulating with the zygomatic bone. It will be articulating with the zygomatic bone, guys. It will be articulating with the zygomatic bone, right? So that is something you already know, right? Now, guys, I just want to make sure over here one important thing, that remember, behind to the zygomatic process, guys, we have these posterior margins, guys, that will be like going behind. Okay, it will be going behind, right? And it forms lines, guys, while going behind. And you already know the lines, guys. These are called as Akib. Very good. These lines which are coming from the posterior margin of the zygomatic process, these are called as, yes, anyone in the chat box, these are temporal lines, right? These are temporal lines, and you already know these temporal lines will be like bifurcating to form the, yes, the superior that will go and fade away, and we have the inferior temporal line, the superior temporal line and the inferior temporal line, and this is nothing but the temporal line. This is nothing but the temporal line. Yes. But I'm just saying it is like extending upwards and backwards, passing like on the parietal bones has a line, guys, that is called as the temporal line, and it will bifurcate into two. The superior one will go much up and it will go and fade away. The inferior one will be going towards and like will be coming down, right? That is called as the temporal lines over here, right? The temporal lines. And you already know area below the temporal line along with the adjacent area of the temporal fossa. it will provide origin to which muscle, guys? Anyone? Below the temporal lines, a muscle is located. बेटा हाँ, वो टेम्पोरल फोसा का भी पार्ट है, ऐसी बात तो नहीं है, बट वो कहाँ से स्टार्ट हो रहा है, दैट यू हैव टू रिमेंबर. Yes, Akit, very good. It is the temporalis muscle. It is the temporalis muscle, and it will also give origin to temporalis fascia. Okay, it will also give origin to temporalis fascia. Now, okay, now, guys. Between the two supraorbital margins, guys, in the midline, you will have the nasal part of the frontal bone. Okay, the first part we have discussed the supraorbital foramen, the supraorbital margin. Now we have the nasal part of the frontal bone. Okay, and the lower part will be like extending, guys. Okay, the lower part, the lower margin is serrated, and it is termed as the nasal notch. It is termed as the nasal notch, guys. It is termed as the nasal notch. It is termed as the nasal notch. So you just have to like see over here in the picture as well, guys. If you can just see, this is the nasal part. This is the nasal part of the frontal bone, and you can just see the lowermost part, which is like serrated, pointing, serrate like, serratus anterior, these sutures, right? This serrate like. So that is called as the nasal spine, guys. This is called as the nasal spine, right? So yes, it is also called yeah, the nasal spine. And remember guys, over here, this lower margin is basically, okay, if I just want to highlight, guys, over here, it is connected from medial to lateral, guys, these serrate margins. And remember, from medial to lateral, they are connected with three bones, guys. In front, we have the nasal bone. Then we have the frontal process of the maxilla. Okay, frontal process of the maxilla. And then we have the lacrimal bone. Medial से lateral की तरफ, medial से lateral की तरफ, we have the three bones, guys. You have to remember. Okay, if you could just see, even over here, guys, or let me just show. Okay, let me just try to show over here, guys. So you can very well see, guys, this is the nasal part, and below the nasal part, you can see, yes, the nasal part. You can see the nasal bone. So medially, it is the nasal bone. Then you can see the maxilla. And the process of the maxilla towards the frontal bone, it is the frontal process of the maxilla. It is the frontal process of the maxilla. And behind that, we have the lacrimal bone, right? This is the nasal. This is the frontal process of the maxilla. And behind that, we have the lacrimal bone. Behind that, we have the lacrimal bone. Right, this is something, guys, you already know. This is something you already know, guys. We have already discussed in norma frontalis, right? So that is again like you have to mention over here, right? Now, again, guys, we have, okay, let me just try to mark over here. We have like the margins, okay, above to the supraorbital notch or the foramen, okay, or supraorbital margin. We have these like margins, right, which you can see over here in this bone. Okay, so there is a slight bony elevation, and that is something called as the superciliary arches. Superciliary arches. These are called as the superciliary arches, right? So above to the supraorbital margins, basically there is a slight bony elevation related to the eyebrows. These are called as the superciliary arches, right? Or supraorbital arches. We can also call it as the supraorbital arches. And I hope you can very well see over here that these supraorbital arches will be basically meeting point. Okay, and that meeting point, guys, it is called as glabella. It is called as glabella. Okay, That is called as glabella. It is more prominent in case of male skull, okay, due to underlying frontal ear sinus, okay. So yes, this is called as glabella, the meeting point of two superciliary arches. The meeting point of two superciliary arches. I hope this is clear to everyone, guys. Just give me a thumbs up in the chat box. Yes. चलो फटाफट से एक thumbs up दे दो chat box में if you it is like clear to everyone, right? Now again guys, you also have to remember over here that chalo I'm waiting for your thumbs up everyone. If it is done, yes, Promise, Shakil, Osama, Akib, very good. What about rest guys? Others are also listening. Just let me know if it is like done guys, right? Virish, Sahidur, Dr. Mehnaz, very good guys. Now guys, above the superciliary arches, we have like two prominences. Prominence का मतलब होता है बेटा उभरा हुआ पार्ट, ठीक है? फ्रंटल बोन में वो पार्ट जो बाहर की तरफ उभरा हुआ है, ठीक है? सो दैट इज या एलिवेटेड पार्ट बोल सकते हो, बाहर की तरफ निकला हुआ छोटे छोटे पार्ट से दोनों साइड. दीज आर कॉल्ड एज फ्रंटल ट्यूबर. दीज आर कॉल्ड एज फ्रंटल ट्यूबर और एमिनेंस भी बोलते हैं इसको, एमिनेंस. फ्रंटल बोन का वो हिस्सा, स्क्वैमस पार्ट का वो हिस्सा जो बाहर की तरफ थोड़ा सा निकला हुआ है, बहुत प्रोमिनेंट एरिया है, दैट इज कॉल्ड एज यस द फ्रंटल ट्यूबर और एमिनेंस, राइट? Now I hope this is clear, right? The frontal tuber, and it is basically deep to it, deep to this frontal tuber, basically the frontal poles will be lying, right? Okay, it is more demarcated in females, more demarcated in children, right? It's the site of commencement, the frontal tuber. Remember, it is the site of commencement of, yes, the site of commencement of ossification centers. Basically, the frontal bones will be like forming over here, and you guys ideally know during the embryological period, guys, just remember there are two frontal bones. They are uniting together with the help of the metopic suture, guys, right? In 90% of the individual, guys, this frontal bone is like only one. Basically, both the bones have fused and we have only one bone left in the like the newborn. But guys, in like 9 to 10% of people, like again, this frontal bones are like not united, they are separated, and yes, we can demarcate metopic suture in between the frontal bones, right? That is something you have to remember over here, right? So again, that is, yeah. Okay, so I hope this is clear. The squamous part is clear to everyone. I hope the squamous part is clear to everyone, guys. The squamous part, it is clear. So you can just mention, guys, if you just want to draw, we have the frontal tuber or prominence, frontal tuber or prominence, right? Okay, and yes, you already know we have the superciliary arches, the superciliary arches, and the meeting point of the two superciliary arches, it is called as glabella. It is called as glabella, right? It is called as glabella. So these are all the important points that you guys should know. Yes. So yes, that is something I want to like tell you over here. Now, coming on to the next part, guys, we have to discuss the okay, first I will be like discussing the inner surface also. We have not mentioned, but we have like the outer surface also and inner surface also, right? Okay. Now guys, internal surface, you should know like 2-3 important points that I wanted to mention over here, guys. The internal surface. अगर बाहर वाला surface है तो अंदर से भी कुछ दिखेगा. The internal surface, guys. Now, if you just try to see, guys, if I just try to draw over here internally, again, these are all schematic diagrams, guys. Please just try to remember over here that initially, guys, remember, okay, initially we have a crest over here, okay, we have a crest. Now crest का मतलब मैंने तुम्हें बताया था, देखो ये एक simple line है, इसी लाइन को थोड़ा सा थिक कर दो तो बॉर्डर बन जाएगा, और इसी बॉर्डर को थोड़ा सा और थिक कर दो तो वो क्या बन जाता है, क्रेस्ट, क्रेस्ट बन जाता है, राइट, वो क्रेस्ट बन जाता है। सो ओवर हियर अगर आप फ्रंटल बोन को निकाल के ऐसे करके देखोगे तो बिल्कुल मिडल में बेटा, बिल्कुल बीच से स्टार्ट होती है, मिडल से स्टार्ट होती है, दिस इज कॉल्ड एज द फ्रंटल क्रेस्ट। इसको हम लोग क्या बोलते हैं, फ्रंटल क्रेस्ट। और यही फ्रंटल क्रेस्ट जो है, ठीक है, दिस फ्रंटल क्रेस्ट बेसिकली yes, remember it's very sharp guys, this frontal crest, it is very sharp, okay, and this frontal crest, okay, that will bifurcate, right, it will be like bifurcating like this, okay, it will be like bifurcating like this. Yes, I'm just coming to that. And remember guys, that will bifurcating and it will commence the sagittal sulcus। ये जो बीच में गैप आपको देखने को मिलेगा, गैप को हम लोग क्या बोलते हैं, sulcus। So yes, obviously it will be called as the sagittal sulcus। Now the sagittal sulcus will lodge the anterior most part of the superior sagittal sinus। इस गैप में ये फ्रंटल क्रेस्ट जो है ये आगे चल के दो लिप्स में बढ़ जाएगा, दो पार्ट्स में बढ़ जाएगा, ठीक है, एक मीडियल और एक लेटरल। और इसी में आप लोगों को यस यू विल बी गेटिंग द sagittal sinus over here, right, you will be getting the बीच में क्या भरा हुआ होगा, इस गैप में सल्कस है, ग्रूव है, so we will have the superior sagittal sinus, the superior sagittal sinus guys, the superior sagittal sinus, okay, and guys remember the margins over here, the margins which I'm like talking about, these margins guys, they will be providing attachment to the falx cerebri, they will be providing attachment to the falx cerebri, right, these two terms I will be like discussing more when I will be discussing the head and anatomy part, head and neck part, but over here just try to remember this is how it looks like, right. Over guys, you should know over here like 2-3 points. The internal surface is basically irregular guys, it is irregular, the internal surface, it is irregular, okay, it is having multiple pits guys, there are multiple pits, okay, and these pits, ये जो गड्ढे हैं, they are created because of the gyri, gyrus और sulci पढ़ा था, gyrus और sulci, right, so these are the gyrus. So basically these multiple pits, they are produced by the gyrus of the frontal lobe, frontal lobe। and internally जब आप frontal lobe को जब आप frontal bone को निकाल के देख रहे हो तो उस bone में ना बीच बीच में you will get these demarcations guys, demarcations, ये markings देखने को मिलते हैं, ऐसे गड्ढे देखने को मिलेंगे, and these are actually produced okay, these are called as vascular markings guys, these are called as vascular markings। and remember guys, this is something which will be like produced by the meningeal vessels, okay, this will be yes, produced by meningeal vessels, जो meningeal arteries होती है, meningeal veins होती है, ठीक है, उनकी वजह से ये produce होता है, produced by meningeal vessels, right, the meningeal vessels, right, so that is something you have to like remember over here, okay. Now below to the frontal crest guys, right, below to the frontal crest you will get a notch over here, right, and yes, one of you have already told this Akib, that is the crista gelli, so it comes in contact beta, ये जो notch होता है ना, it basically comes in contact with the notch of the ala of the crista gelli, and together they will be like forming a foramen that is called as foramen cecum. Foramen cecum, although like no particular function is known till date, but just remember that sometimes it will allow the passage of emissary veins, right, but as of now like we don't have to like go in that much detail. So yes, over here guys, yes, we will have, yes, you already know the emissary veins like will allow okay, it will communicate to the superior sagittal sinus and even with the veins of the nasal mucosa. Now again that is something you have to like remember. We have like ethmoidal canals also like situated on the sides, the ethmoidal canals, right? We have ethmoidal canals, right? So that is again you have to remember in case of these frontal bones. So I hope the internal surface is clear to everyone. Just give me a thumbs up in the chat box if the internal surface is clear to everyone. चलो फटाफट से थम्स अप दे दो अगर इंटरनल सरफेस क्लियर हो गया तो. चल okay, just I'm waiting for your thumbs up guys so that I can like move on. चलो शकील very good beta. Now guys, I will be discussing, we have discussed the squamous part, the forehead, the outer and the inner surfaces we have already focused on. Shahidur Rahman, very good. Now guys, I will be coming on to the nasal parts and these are like very easy guys. The third one that you already know, we have the nasal part. And in the nasal part guys, you know, it is the portion of the bone which projects downwards, right? If you can just see the image, it projects downwards guys and it is giving attachment to three parts. You can see the nasal bone from medial to lateral, medial से lateral की तरफ guys. फिर उसके बाद maxilla का जो process ऊपर की तरफ आता है, ठीक है, उसको क्या बोलोगे? We will call it as frontal process of maxilla. इसको क्या बोलोगे? Frontal process, क्योंकि frontal bone की तरफ आ रहा है, so it is frontal process of maxilla. और उसी के पीछे guys we have the lacrimal bone. उसी के पीछे we have the lacrimal bone. We have the lacrimal bone guys. We have the lacrimal bone. Right? So you already know this. You have already seen this. Okay. So we have already discussed nasal frontal process of maxilla and we have the lacrimal bone. And we have the lacrimal bone. Right? So you just have to remember in nasal part that it is portion of the bone which projects downwards. Okay, it projects downwards between right and left supraorbital margin. Right and left supraorbital margins. Right? So this nasal part presents a nasal notch, and this nasal notch will articulate inferiorly with three bones. Okay, so you already know from medial to lateral. From medial to lateral, we have like the nasal bone on both sides. Then we have frontal process of maxilla. Frontal process of maxilla and the lacrimal bone. And the lacrimal bone. तो मीडियल में नेसल हो गई, उसके साथ मैक्सिला का बोन का पार्ट जो ऊपर की तरफ आ रहा है फ्रंटल प्रोसेस ऑफ मैक्सिला और उसके पीछे लेक्राइमल बोन. उसके पीछे क्या हो जाएगा? लेक्राइमल बोन. So that is about the nasal part. Coming on to the third one guys, the fourth one over here that I will be focusing on, that is the orbital plates. The orbital parts, or I can simply say the orbital plates. The orbital plates guys, the orbital plates. Now it is again having like guys two surfaces. Okay, it is a curved plate. Firstly you should know it is a curved plate and it extends like posteriorly beyond the orbital margins. If you can just see over here guys in this part, so you can see it is extending posteriorly also, right? And this is the orbital margin above and it is extending posteriorly. So these are actually the curved plates. These are actually the curved plates which you can like focus over here. And it is like triangular in surface guys. It is triangular in surface. If you just clearly see the shape guys, it is triangular in surface. And guys, if it is triangular in surface, चलो अगर ये triangular है surface में तो फटाफट से इसके parts लिख लेते हैं. Okay, it is triangular in surface. Okay, triangular in shape, actually shape. So it has two surface, guys. Remember, we have orbital surface and we have cerebral surface. We have orbital surface and we have cerebral surface. देखो एक सरफेस बेटा ऑर्बिट की तरफ है, अगर ध्यान से देखोगे ये वाला जो सरफेस है जो मैं हाईलाइट कर रहा हूं बेटा, ये वाला जो सरफेस है ये ऑर्बिट की वॉल बना रहा है। अगर तुम देखोगे तो ये ऑर्बिट की वॉल बना रहा है, तो इसको ऑर्बिटल सरफेस बोल सकते हैं। और इसी सरफेस के अंदर मतलब उस साइड, ठीक है, बिहाइंड वी विल हैव अ सरफेस दैट इज कॉल्ड सेरिब्रल सरफेस, जो ब्रेन का सेरिब्रल पार्ट वाला हिस्सा फेस करेगा। एक तो ये बाहर की तरफ हो गया जो मतलब नीचे है जो ऑर्बिट बना रहा है, और एक इसके पीछे वाला जो है, देखो एक फ्लैट चीज के दो हिस्से हो सकते हैं, एक तो ये वाला पार्ट है जो ऑर्बिट बना रहा है और एक ये वाला पार्ट होगा जो ब्रेन की तरफ है, जो ब्रेन की तरफ है। सो that is something you have to remember, and guys remember it has like three margins guys that you have to remember. एक मार्जिन तो बेटा यू ऑलरेडी नो वी हैव द मीडियल मार्जिन, एक हमारा हो जाता है लेटरल मार्जिन गाइस, और एक हमारा हो जाएगा पोस्टीरियर मार्जिन, पीछे की तरफ है। पीछे पोस्टीरियर बॉर्डर हो गया, एक मिडलाइन की तरफ मीडियल बॉर्डर, और एक साइड में हो जाएगा दैट विल रिप्रेजेंट द लेटरल बॉर्डर, दैट विल रिप्रेजेंट द लेटरल बॉर्डर। सो रिमेंबर गाइस ये जो ऑर्बिटल पार्ट है इसके दो सरफेस और तीन मार्जिन हैं या तीन बॉर्डर्स बोल सकता हूं मैं, थ्री मार्जिन और थ्री बॉर्डर्स आई कैन से, एंड यू ऑलरेडी नो इट इज मीडियल, it is lateral, and we have posterior. Medial, lateral, and posterior. Medial, lateral, and posterior. Right? Now the two orbital plates, guys, if you can just focus over here, the two orbital plates, basically they're giving a U-shaped notch over here. They're giving a U-shaped notch over here. And yes, that notch will be providing attachment to the ethmoid bone, right? That will provide attachment to the ethmoid bone, right? And remember it will be like the cribriform plate of the ethmoid bone. I will be discussing the ethmoid bone also, so as of now just remember it is the cribriform plate of the ethmoid bone, right? So yes. So that is something you have to remember. Zygomatic process, guys, you already know, right? The zygomatic processes you already know, guys, right? Zygomatic process, yeah, it will join the frontal process of the zygomatic bone, right? And you already know it will form the joint, okay? So that is something you already know, guys. And ethmoidal notch we have already seen. If you just want, I can just show you one picture over here which I have taken. Yes, can you see the zygomatic process? And I hope you can appreciate this is the notch, that is the ethmoidal notch. Yes, over here, guys, you will also find, yes, yeah, we can also find basically, okay, the posterior part of the roof. If you just see the posterior part of the roof, guys, okay, the posterior part of the roof, it is completed by the lesser wing of sphenoid. Okay, lesser wing of sphenoid also, right? And we have a fossa anterior laterally, and if you can just see, it is the fossa for the lacrimal gland, that is also called as the lacrimal fossa, okay, which lodges the orbital part of the lacrimal gland, right? So that is something. And if we talk about the cerebral surface, guys, over here, if we talk about the cerebral surface, it is also gyrated, presence of the gyrus and gyri, right? Gyrated, pitted, right? There will be multiple holes in it, right? Because of the gyrus, right? So it forms the major part of the anterior cranial fossa, right? So that is you have to remember over here, right? If we talk about the articulations, guys, you already know the articulations. We have discussed the parts, right? Zygomatic process, guys, I think you already know. I don't need to repeat it again and again. But as of now, just remember, yeah. If we talk about the articulations of the bone, The articulations you already know. Yes, posteriorly it is the greater and lesser wing of sphenoid bone. Lesser and greater wing of sphenoid bone. Okay, sphenoid bone, right? Zygomatic process, you already know it forms, yes, articulates with the zygomatic bone. Zygomatic bone. Nasal part articulates with the nasal bone, and you already know also with the frontal process of maxilla. Frontal process of maxilla, and even the lacrimal bone. Lacrimal bone. Okay. Orbital parts basically are the ones which are no articulating with the greater and lesser wing of the sphenoid bones, right? And that is something you have to remember. Okay. Now, if we just try to discuss the clinical correlation, okay, or the applied anatomy or the clinical correlation, so you already know frontal bone ossifies in the membrane. Okay, the primary centers appears one for each of the frontal lobe. Okay, at birth the frontal lobe is made up of two halves separated by median frontal suture or the metopic suture. So the union basically takes place at the second year and is completed by the eighth of at by the end of the eighth year, guys. Right? So yes. So the remains of this suture basically you already know a point that is called as glabella. So in an adult, if you want to find the remains of the suture, it is like exactly at the glabella, which you will be like you can see. Okay, and it's termed as metopic suture. You already know. So yes, if there is any fracture of the orbital plate, guys, if there is any fracture of orbital plate, remember guys, it will be leading to orbital plate of frontal bone. It will be leading to hemorrhage in the orbit. It will be leading to the hemorrhage in the orbit, right? Hemorrhage requires a triangular shape, right? So that is something you have to remember. Just one clinical correlation. So I hope this is clear to everyone. Just give me a thumbs up in the chat box, guys, if this is clear. So this bone is done from my side. So just give me a thumbs up in the chat box if this is clear. If the frontal bone is clear to everyone over here. The frontal bone is clear to everyone over here. चलो फटाफट से एक थम्स अप दे दो चैट बॉक्स में. Hmm. Let us now just try to discuss the zygomatic bone. फटाफट से zygomatic bone पढ़ते. शकील शहीदुर रहमान, very good. What about rest, guys? What about rest? Hmm. Others alive? Hmm. चलो बाकी सब जिंदा है. Now let us first try to fastly discuss about the zygomatic and the maxilla bone also. Now coming on to the zygomatic bone, guys. Now coming on, Sashank Murthy, hello beta, hello. Now coming on to the zygomatic bone, you already know that this bone, if we talk about this bone, guys, yes, this bone. If you can just see over here, guys, this is a paired bone. Zygomatic bone, it is a paired bone, right? It is a paired bone. You should know it is diamond shaped. It is diamond shaped, right? Third important point, you should know it is also called as malar bone. It is also called as malar bone, or because it forms the prominence of the cheek, which is called mala in Latin. Okay, so it forms the prominence of cheek, which is called mala in Latin. Okay, it is called as mala in Latin, right? So you already know. So it is diamond shaped. It is also called as malar bone, right? Because yes, it's called mala in Latin, right? The cheek. Now, I hope I'm audible and visible, guys. Just give me a thumbs up if everything is fine. Great, thumbs up दे दो if everything goes good. चल, okay, Venki, okay, perfect. चलो ठीक. Now, if we talk about the parts, guys, of the zygomatic bone, remember it consists of like three parts. Majorly, we have one body and we have two processes. One body and two processes. We have one body and two processes, guys. The shank, very good. One body and two processes. So you can very well see the one. Okay, let us first try to see in the main skull, guys. If you can just see, this is the zygomatic bone. This is the zygomatic bone, right? The zygomatic bone, it is basically having like two processes over here. Can you see one process which is going towards the frontal, towards the temporal bone? Can anyone tell me the name of this process which is marked with A? And can anyone tell me the name of this process which is marked with B, which is going towards the frontal bone, right? So yes, anyone in the chat box would like to, yeah, show some knowledge, guys. You already know the one which is going towards the temporal bone. It is called as the temporal process of zygomatic bone. देखो zygomatic bone का ही part है, जा किसकी तरफ है, temporal bone की तरफ. So it is called as temporal process of the zygomatic bone, and the above one, it is called as the frontal process of the zygomatic bone. The frontal process, yes, Shahidur Rahman, very good. Frontal process of zygomatic bone, very good, very good. So we have like two processes, frontal and temporal. The frontal and temporal, right? So we have like, yes, so we have like two processes. You already know frontal and temporal. Frontal and temporal. Frontal and temporal. Yes, everyone is right. Now guys, coming on to the body. Let me just write it over here. If we talk about the body, guys, the body has, yes, the three surfaces. Three surfaces. Okay, and just remember, guys, we have like three surfaces. Yes, we have the lateral surface, the lateral surface, the orbital surface, the orbital surface, and the posterior surface, and the posterior surface, and the posterior surface. Now, guys, if we just try to focus over here, if we just try to focus over here, if we just look at the image, guys, if we just try to look at the image, the one बेटा ये जो बाहर की तरफ है, अभी खुद बता दो कि बॉडी का मिड लाइन ये है, ठीक है, बॉडी का मिड लाइन ये है, और ये जाइगोमैटिक बोन एक बेसिकली क्या है, एक फ्लैट बोन है. तो एक बाहर वाला सरफेस हो गया जिसको लेटरल सरफेस भी बोल सकते हैं, ठीक है. एक जो अंदर वाला सरफेस है वो ऑर्बिट बनाएगा, ठीक है, वो ऑर्बिट बनाएगा, तो उसको ऑर्बिटल सरफेस भी बोल सकते हैं, ठीक है. उसको क्या बोल सकते हैं, एक ऑर्बिटल सरफेस भी बोल सकते हैं. और एक सरफेस पीछे की तरफ होता है, that is called as the posterior surface. That is called as the posterior surface. So we have actually three surfaces, right? So yes, the one which is forming the lateral one, yes, the outer one, the cheek one, that is something you have to remember over here. Yes. So let us just try to look it at one by one. लेटरल सरफेस को हम लोग आउटर सरफेस भी बोल सकते हैं, और इसको हम फेशियल सरफेस भी बोल सकते हैं, क्योंकि ये फेस का पार्ट बना रहा है. एक एक करके देखते हैं, कोई दिक्कत नहीं है, एक एक करके देखते हैं, कोई दिक्कत नहीं है, ठीक है. सो लेटरल सरफेस जो है बेटा, रिमेंबर इट इज सबक्यूटेनियस, इट इज सबक्यूटेनियस, इट कैन बी फेल्ट अंडर द स्किन, इट कैन बी फेल्ट अंडर द स्किन, इट इज सबक्यूटेनियस, राइट. And remember, guys, ये जो लेटरल सरफेस में आप लोग को दिखा रहा हूँ ये एक्सटर्नल व्यू है गाइस, ये एक्सटर्नल व्यू है, ठीक है, बाहर से आप देख रहे हो तो ये लेटरल सरफेस है, ठीक है, ये देखो फ्रंटल प्रोसेस है ऊपर, ठीक है, ये जाइगोमैटिक प्रोसेस है, ठीक है, और इसी सरफेस पर एक फोरामेन देखने को मिलता है दैट इज कॉल्ड एज जाइगोमैटिको फेशियल फोरामेन। यहीं पर एक फोरामेन देखने को मिलता है दैट इज कॉल्ड एज जाइगोमैटिको facial foramen, right? And remember guys, this foramen is basically giving passage to zygomatic facial nerve and vessel, zygomatico-facial nerve and vessels, that is the arteries and veins. Zygomatico-facial nerve, zygomatico-facial artery, and zygomatico-facial nerve, right? So that is something you have to remember, okay? Now, just below the infraorbital margin, right? The infraorbital margin, okay? Yes, that is I hope every like clear to every one of you over here, right? If we talk about the orbital surface, guys, if we just focused on the orbital surface, you guys already know it is smooth, okay? Let me just try to write it over here. Internal view, okay? This is the internal view. This is the internal view. Okay, if you can just see the orbital surface guys, the one which is like above, the one which is forming the orbit part, right? So एक तो बाहर की तरफ हो गया लेटरल, एक अंदर की तरफ, you already know अंदर वाला हमारा क्या हो गया, yes, the posterior वाला पार्ट, एंड एक जो ये ऑर्बिट वाला पार्ट बना रहा है ऊपर जो ऑर्बिटल वॉल बना रहा है दैट इज द ऑर्बिटल सरफेस, इट इज स्मूथ कनकेव. If we talk about the orbital surface, remember beta, it is smooth, it is concave, right, and forms part of floor. It forms part of floor and lateral wall of orbit. नीचे का फ्लोर जो है और लेटरल वॉल जो है ऑर्बिट की वो बनाता है lateral wall of orbit. It forms the part of floor and the lateral wall of the orbit, right? Now guys, below this orbital margin guys, you will be watching a foramen over here. Let me just try to show you. Yes, and that is called as the zygomatico orbital foramen guys. You can see these foramens present on the surface. That is called as the zygomatico orbital foramen. Zygomatico orbital foramen. So over here you will be below the orbital margin, right? Now this is the orbital margin guys. If you can just see, this is the orbital margin and the inferior orbital margin, and below this orbital margin, okay, below orbital margin or the inferior orbital margin, you will be able to see a foramen, and that is called as zygomatico orbital foramen. So basically it is a Y-shaped canal. It will be leading into a Y-shaped canal, right? So yes, one limb basically will be opening in front of the zygomatico facial foramen guys, in the front guys, right? Zygomatico, one part it will be like opening in the front, that is in the form of zygomatico facial foramen. Okay, another will be opening into the posterior surface. Okay, and that is guys over here you can just visualize, it is called as zygomatico temporal foramen. It is called as zygomatico temporal foramen. बेसिकली बेटा ये कैनाल की तरह होती है, एक आगे की तरफ खुल रही है, ठीक है, एक आगे की तरफ खुल रही है दैट इज कॉल्ड एज zygomatic facial foramen, और एक पीछे वाले सरफेस पर आकर खुल रही है दैट इज कॉल्ड एज zygomatic temporal foramen. So yes, we have the zygomatico, it will be opening into zygomatico, yes, the facial foramen that we have already discussed, and we also have the zygomatico-temporal foramen. Zygomatico-temporal foramen, and that is which will allow the passage of, yes, the zygomatico-temporal vessels and nerve. Okay, it will allow the passage of zygomatico-temporal vessels and nerve. Okay, maticotemporal vessels and nerves, right? So that is something you have to remember, guys, over here. Now, if we talk about the, yes, the posterior surface, guys, the posterior surface, okay, or I can simply say the temporal surface. Temporal surface, it is also called as the posterior surface, guys. Okay, the posterior surface, it is also called as the temporal surface. The temporal surface, guys. Remember, it is rough. Okay, it is smooth and concave, like more posteriorly. Now, the rough anterior part basically will be articulating with the maxilla. The posterior part, it will be like articulating with the, yes, the anterior part of the temporal bone and the infratemporal fossa. So over here, just you have to remember one foramen, that is, you can see the zygomatico-temporal foramen. Okay, so allows passage of zygomatico-temporal vessels and nerves, right? So again, guys, these are the three surfaces that you have to like remember. Okay, so we have like various borders also, guys. If you can just see over here, if we talk about the body has like three surfaces, and remember, guys, we have many borders over here which you can just see. So it has three surfaces, and I would be like assuring that there are 5 borders in the body. In the body, we have the 3 surfaces which we have discussed. We also have like 5 borders. 5 borders. Guys, over here, if you can just see, we have this border, this line, that is antero-superior border. We have antero-superior border. We have, yes, the posterior-superior border. Posterior-superior border. Then we have antero-inferior border. Antero-inferior border. Then we have, yes, you should know the posterior-inferior border. Posterior-inferior border. And one border basically beta, like behind you will see, yes, one border, yeah, that is called as the posterior-medial border. Okay, that is called as, yes, behind. Let me just try to show you. Yes, we have the posterior-medial border, like going behind and in the midline. We have the posterior-medial border over here, right? Not here exactly. Cannot appreciate over here. Yeah, but I don't have like picture over here. Okay, so yes, we have the posterior-medial border as well. Okay, so now, guys, over here, just try to remember. Over here, just try to remember the antero-superior border. Basically, it forms the inferolateral margin of the bony orbit, right? Obviously, it is like forming the inferior part of the orbit. Okay, so antero-inferior will be like articulating with the maxilla, right? We have the maxilla bone. Okay, so yes, the posterior superior border, basically it is in the form of a letter F. You can just see basically it's written in like italic alphabet F. Okay, so yes, that is you have to remember over here. And the two processes, guys, I hope you can appreciate. This is the left maxilla. We have the frontal process and we have the temporal process. This is the left maxilla. We have the frontal process and the temporal process, right? So I hope I don't need even to tell you the frontal process. It is basically, okay, let me just write down over here. We have two processes, the frontal and, yes, the temporal. The frontal and temporal. Remember, the frontal is thick. Okay, it is upward, right? It articulates with the zygomatic process of the frontal bone. Okay, it articulates with zygomatic process of frontal bone. Zygomatic process of frontal bone, right? So yes. Now guys, over here I just want to tell you one more thing. Okay, now frontal process, the orbital surface guys, if we talk about the orbital surface of the frontal process, not this surface, if I'm just focusing on, okay, if I'm just focusing on the surface, okay, if you can just see the surface which is like inside, the surface which is like inside, that is the orbital surface which is forming the orbit. Remember that it will guys basically what will here, it will be a small tubercle near the orbital margin. Okay, there will be a very small tubercle over here near the orbital margin, like 1 centimeter just below the frontozygomatic suture, and that tubercle guys over here, it is called as the Whitnell's tubercle. Very important, it is called as the Whitnell's tubercle, or it is also called as the frontozygomatic. I mean, yeah, basically you should remember it is just 1 centimeter below the frontozygomatic suture इन द ऑर्बिटल सरफेस. देखो ऑर्बिटल प्रोसेस के दो पार्ट होंगे, एक बाहर की तरफ निकला हुआ है और एक जो अंदर वाला ऑर्बिट बना रहा है, ऑर्बिटल वॉल बना रहा है. तो फ्रंटो जाइगोमैटिक सूचर जो है उसके जस्ट 1 सेंटीमीटर बिलो एक ट्यूबरकल देखने को मिलेगा, एक राउंडेड बोन का हिस्सा देखने को मिलेगा. ट्यूबरकल का मतलब क्या होता है? राउंड स्ट्रक्चर ऑफ द बोन, and that is called as the Whitnell's tubercle. That is called as the Whitnell's tubercle, right? So that is again you have to guys remember over here. Okay, so I hope this is clear to every one of you. Beta, just give me a thumbs up in the chat box if this is clear to each one of you. If this is done to each one of you, just give me a thumbs up in the chat box. चल फटाफट से एक थम्स अप दे दो जल्दी से चैट बॉक्स में. Shakil, okay, we'll be discussing the most important bone right now. That is again the maxilla. I will be discussing the maxilla in detail, guys. Again, that is something very important. Yeah. Surgical importance is a surgical landmarks. Now, I will be discussing about the maxilla, guys, and please just focus over here that it is the left maxilla which I have shown. It is the left maxilla which I have shown. Guys, you already know maxilla are two in number. Two in number. Now we have the left maxilla and the right maxilla. Can anyone tell me in the chat box if the two maxilla are joined together by the which suture, guys? Can anyone tell me the name of the suture? Just the name of the suture. I'm not asking the type of the suture. I just want the name of the suture, guys. Can anyone tell me the name of the suture? Yes. चलो फटाफट से बता दो जल्दी से. Very good, Shakil. Very good. It is the intermaxillary suture, beta. It is the intermaxillary suture. Yes, it is the intermaxillary suture. Very good. Very good. Beta, right or left maxilla? If you just want to see beta over here in the skull. चलो पहले बहुत बेसिक से स्टार्ट करते क्योंकि आई पर्सनली बिलीव कि तुम लोग को थोड़ा थोड़ा बेटा देखो बोन्स के बारे में भी. अगेन आई एम टेलिंग यू गाइस, वी विल गो थ्रू हेड एंड नेक वेरी डीपली. बेसिक चीजें अभी सीख लो बिकॉज इट्स वेरी डिफिकल्ट टू टेल यू ईच एंड एवरीथिंग एट द सेम टाइम. एवरीथिंग विल गो बियॉन्ड योर हेड्स. जैसे जैसे चीजें आती जाएंगी, as soon as the things will come, you will be learning it again and again. So no need to like worry at all over here, right? So yes. So you can very well see over here we have like two maxilla, guys. We have like two maxilla, and these two maxilla are basically like, yeah, joined together with in the middle with the help of a suture. and that is called as the intermaxillary suture. Intermaxillary suture, right? We have like two maxilla that are joined together with the help of the intermaxillary suture. So remember guys, let us just try to write this maxilla is like something very important, so we cannot take risks to like forget like other bones, but please just try to mention all the important points that I'm writing with you, right? So yes, so they are two in number. Basically they are joined together to form intermaxillary suture. Intermaxillary suture. And remember guys over here, they together form the upper jaw. Together form upper jaw, right? They are irregular bones. They don't have a definite shape, guys. They are irregular bones. And remember guys, they are pneumatic bones. They have the maxillary air sinus, so they are also classified under pneumatic bones. So they are pneumatic bones. They are pneumatic bones, right? They are pneumatic bones. Maxilla, basically, it is the second largest bone of the face. Again, one important point, it is the second largest bone of the face, right? It is the second largest bone of the face. Okay. Now, it consists of 5 parts, guys, right? So firstly, you have to just identify the maxilla. If I just give you a maxilla in the exam, how will you guys identify whether it is like right or left maxilla? Anyone in the chat box who would like to comment on the structure, guys? So you have to remember the anterior surface, guys. The anterior, if we talk about side determination, side determination. We have to tell how to identify which one is right and which one is left. So remember guys, nothing you have to like remember the anterior part, the anterior surface, it is like concave, posterior, it is like convex. आगे वाला जो हिस्सा है बेटा, it will be like more concave, the posterior will be more convex, right? Now guys, if this is the left maxilla, if I'm just assuming this is the left maxilla, guys, you already know this is the midline and this will be the lateral side. Okay, this is the midline and this will be the lateral side. Can you see a part of the bone going upward? And upward it is articulating with which bone, guys? Anyone in the chat box would like to tell? Upward it is also articulating with which bone, guys? Anyone in the chat box? बेटा ऊपर की तरफ फ्रंटल बोन है, मैंने अभी बताया था. आगे नेजल है तो ऊपर की तरफ फ्रंटल बोन भी है. ठीक है, ऊपर की तरफ फ्रंटल बोन भी है. सो बेसिकली दिस इज कॉल्ड एज द फ्रंटल प्रोसेस ऑफ मैक्सिला. फ्रंटल प्रोसेस ऑफ मैक्सिला. सो रिमेंबर द फ्रंटल प्रोसेस जो है वो हमेशा कहाँ डायरेक्टेड होता है? मीडियली. द फ्रंटल प्रोसेस इट इज ऑलवेज डायरेक्टेड मीडियली. ओके, सो द फ्रंटल प्रोसेस basically remember it is directed medially. Right. So yes. Now guys, you already know that there is a zygomatic process. Basically it is articulating with the zygomatic bone also, even if you can just see over here, yes, this triangular shaped area. Okay, and yes, medially we also have one more process, guys, that is called as the palatine process, right? So the maxilla is also articulating with the zygomatic bone, and yes, this triangular part area, that is the zygomatic bone, which is like located more sidewards, guys, right? Yes, study with Noren, very good. Now there are many processes also, like we will be discussing that also in our this part. So as of now guys, just remember, let us first start with the parts. I will be coming to this okay. Oh shit, I have removed it. Oh god. Okay, I will be coming to this part. Now I will be like focusing on the parts of the maxilla. Parts of the maxilla, right? So remember guys, we have the body of the maxilla, and remember it is pyramidal in shape. Okay, it is pyramidal in shape. You can very well see right over here. It consists of 5 parts, beta. Um, so we have the body of the maxilla, right? And yes, we have different 4 processes, guys. 4 processes. Now, the body of the maxilla, will be like okay, let me just write it down in this way. So we have the body and 4 processes. 4 processes. Now, in the body part, Peter, remember the body, it is pyramidal in shape, and remember it contains a large cavity, and that is called as the maxillary air sinus. Maxillary air sinus, right? The maxillary air sinus. Okay, and basically the body has 4 surfaces, guys. 4 surfaces. We are going to discuss each surface in detail. We have the anterior surface. Remember the anterior surface, it is also called as the facial surface. The anterior surface or the facial surface. Then we also have, yes, the nasal surface or the medial surface. We also have orbital or the superior surface. Then we have the infratemporal or posterior surface. Infratemporal or posterior surface. So we are having like 4 surfaces over here, right? The anterior, beta जो आगे की तरफ है, obviously the surface which you can see over here, this is the anterior surface जो face बना रहा है, ठीक है? जो nose की तरफ है, we also have the nasal surface, guys. Let me just try to show. Yes, the one which is forming the nose, okay, that is called as the nasal surface. ऊपर जो orbit बना रहा है, we have the orbital surface also, right? So let us just try to see one by one each surface in detail. One by one each surface in detail, right? Okay, before coming on to the surfaces, guys, you should know we have like 4 processes over here, and that you already know. We have the frontal process of the maxilla, the frontal process of maxilla, the zygomatic process, we have the palatine process, and we have the alveolar process. The alveolar process of maxilla, right? We have the alveolar process of maxilla. So let us just try to discuss it one by one. Now, if we talk about the anterior surface first, you guys can very well. Okay, let me just try to draw it, guys, for you people. Now let me just try to draw it for you people so that you can. Charger is not working. I hope all are present. Yeah, obviously the medicos only have this, like they can attend my lecture at night as well. Now guys, just try to remember, guys, if I just try to show you guys, if this is the frontal process, right? If this is the frontal process, Okay, we already know we have like two margins beta over here. We have like two margins over here. Okay, so yes, that is something you have to like remember. Hmm. We have like two margins over here. So now guys, remember that we have a frontal process above, and I'm trying to show you the anterior surface. I'll be like more talking about it as like the outer surface over here, right? So we have the frontal process of the maxilla, right? The frontal process of the maxilla, and on the lower part we have this, the alveolar border, okay, or the alveolar surface, guys. If you can just see over here, we have different teeth which are like located. Okay, we have over here, right? The incisors are there. Then we at last we have the molars. We have the incisors over here, right? So we have these like the lower part that is called as the alveolar process below. Okay, we have the alveolar process below, and you already know it is forming the alveolar border, and this alveolar border, it is basically consisting of these tooth, and I mean the tooth sockets, और इसी में हमारी क्या आती है टीथ, इसी में हमारी क्या आती है टीथ. So we have a frontal process above, and we can obviously see we have the alveolar process which is like below, which is actually the alveolar border which is containing these tooth, the molars, incisors, right? And you already know they are containing tooth and the tooth socket and the teeth, right? So that is something you have to like remember, guys, over here. Okay. A triangular shaped area, guys, I hope you already know, which is like looking broken like over here. This is called as the zygomatic process. The zygomatic process, guys. This is called as the zygomatic process, right? Now, चलो इतना क्लियर है सब लोग को, बेसिक बेसिक प्रोसेसेस पता चल गए सब लोगों को, right? Now, in the frontal process, guys, we have like origin of, हाँ हाँ, इतना क्लियर है सब लोग को, ये बता दो पहले. Now, just behind the zygomatic process, guys, just behind the zygomatic process, we have a foramen, guys, over here. And that foramen, it is called as the infraorbital foramen. Infraorbital foramen. And remember, guys, just above the infraorbital foramen, basically a muscle is originating, and that is called as the levator labii superioris. Levator labii superioris. Please just try to like mark it. As of now, we'll be discussing all the bones and like muscles separately also. And just below the infraorbital foramen, another muscle is getting originated. Remember, that is called as levator anguli oris. Levator anguli oris, right? So yes, that is something you have to remember. Now, guys, this part, if we specifically like I talk about this part over here, yes, this part, it is basically forming the nasal notch. The nasal notch, guys, the one which is forming the nasal notch. If you just want to see over here, I hope you all can appreciate, guys. This is the one which is forming the nasal notch, guys. The nasal notch. Right, this is the zygomatic process, which is like looking triangular in shape, and over here you can just appreciate one foramen that is called as the infraorbital foramen, right, just behind the nasal notch, right? So yes, the behind the nasal notch. So above we have a muscle, yes, above we have a muscle, and below we have a muscle. Above it is levator labii superioris, and below we have, yes, the levator anguli oris, right? So that is all the both muscles which are like getting originated from this part, right? So this is the frontal process, and frontal process is basically the medial border is basically like a notch that is called as the nasal notch because it is forming the nose, right? Medial यही होगा बेटा और lateral ये होगा, right? So ये left maxilla है ना, तो left वाले की तरफ से देखो तो midline तो यही हो गया, right? So that is something you have to remember. So just at the nasal notch, guys, you can remember there are one or two more muscles that you can just remember as of now. Yes, we have a nasalis muscle just along the this nasal notch. We have this nasalis muscle, okay, and below guys we have like two muscles over here that is called as depressor septi muscle, okay, and just below towards the alveolar margin we have this orbicularis oris muscle, orbicularis oris muscle, orbicularis oris muscle, okay. So yes, coming on to like the most if I just try to highlight, guys, this is the most posterior surface you can just see over here. This is the most posterior surface which you can like focus over here, right? तो आगे तो anterior इस तरफ हो गया, ठीक है. Posterior surface की अगर बात की जाए, guys, so yes, below we have a muscle over here. Yes, and that is called as the buccinator muscle, buccinator muscle. So yes, buccinator muscle, right? So yes, above you already know we have a surface that is called as superior surface, और superior surface को guys हम लोग orbital surface भी बोलते हैं, वो orbit बनाता है, ठीक है. posterior surface temporal bone की तरफ है, तो posterior surface जो ये येलो वाला मैंने साइन किया है posterior surface, ये बेसिकली infratemporal part भी बनाता है, तो उसको हम वो भी बोलते हैं, right? So yes, Rahul Khan, अभी like Rahul, if I just remember, I remember many Rahul. So are you from Kazakh Russian Medical University? Have you like spoken before? Or like the only Rahul which I can like clinch at this point. हम्म. तो ये था बेसिकली एंटीरियर, थोड़ा सा पोस्टीरियर भी मैंने आप लोग को दिखाने की कोशिश की है, राइट? सो यस, so anterior surface, it is basically forming the norma frontalis, okay. So 1 centimeter below the infraorbital margin. So basically it is like giving this foramen, guys, that is called as the infraorbital foramen, right? Now this infraorbital foramen will carry the infraorbital nerve and vessels, infraorbital nerve and vessels. तुम तो गायब ही हो गए हो राहुल, लास्ट कब बात हुई होगी अपनी, 4-5 साल पहले. So that is something you have to remember. Just above the alveolar process. So yes, we have the incisive fossa bit over here. और इसी incisive fossa में ना, from medial to lateral we have the incisive. Incisor के ऊपर present होता है. We have the incisive fossa. ठीक है. फिर बाहर की तरफ निकला होगा. That is the canine eminence. ठीक है. फिर हमारा आ जाता है canine eminence. कैनाइन्स के ऊपर कैनाइन एमिनेंस, और फिर एमिनेंस के साथ आ जाता है कैनाइन फोसा, कैनाइन फोसा. सो कैनाइन एमिनेंस बाहर की तरफ क्यों निकला हुआ होता है? एमिनेंस का मतलब बाहर की तरफ प्रोट्रूशन होगा. इट इज कॉज्ड बाय द रूट ऑफ द कैनाइन टूथ, इट इज कॉज्ड बाय द रूट ऑफ द कैनाइन टूथ, राइट? आई होप like I'm audible and visible to everyone. हाँ, ठीक है. So that is something you have to like remember as of from the anterior part also, right? Like if we just try to show the medial aspect, right? If I just try to show the medial aspect, even the medial aspect, guys. Yes. Okay, guys, over here I just forgot to mention one fossa over here, right? We have Okay, we have a depression, or yeah, the infraorbital groove is there, like in between, like passing through like this. So yes, we have this infraorbital groove also, which is carrying the infraorbital canal, and this canal is carrying the infraorbital nerve and vessels, right? So that is infraorbital groove you can also mention. Middle part is again, guys, very like easy. Just try to remember, guys. Okay, I'm like drawing very roughly, guys, so that you all have an idea about over here, right? So we have like various tooth, guys, below, right? You already know the alveolar border is there. Alveolar border is there, right? You can very well see we have the palatine process of the maxilla. Palatine process which is forming the hard palate, guys. The palatine process. मैंने ये तुम्हें base of skull में भी दिखाया था. If you can just like look into this picture, guys, over here. If you can just focus on to this picture which I have, I think I will just try to show it. Yes. Let me just try to show you, because that will like clinch to your part as well. Hmm. This is the palatine process of maxilla. ये hard palate बनाता है बेटा, ये hard palate बनाता है. This is something which is forming the hard palate, right? This is something which is forming the hard palate. So ये palatine process है, ठीक है? Palatine process of maxilla, palatine process of maxilla, right? Palatine process of maxilla. Let me just go into the front. Hmm. Right? So over here, just try to remember the palatine process, right? A part, okay, which is forming the inferior meatus. Now, guys, in the nasal part, like we have the three meatus, the three openings, guys, the superior, middle, and the inferior. The superior and middle are basically the parts of the ethmoid bone. The inferior meatus you will found on the medial aspect of the maxilla, right? We have the antrum of the middle meatus, right? We have the antrum. Okay, we have the ethmoidal crest over here. Okay, we have the ethmoidal crest. We have something called as maxillary hiatus, and we also have the nasolacrimal groove, which carries the nasolacrimal duct. The nasolacrimal groove, which carries the nasolacrimal duct. So that is you have to like remember. If we just try to show over here, guys, you can very well see. Yes, you can very well see we have the maxillary hiatus, right? The maxillary hiatus, you can see the one which is forming the, yeah, the palatine process of the maxilla, right? Yeah, the palatine process of the maxilla, it's like broken. We have the alveolar border. We have the inferior meatus, guys, the lower part of the nasal cavity over here, right? Meatus basically doesn't mean an elevation, guys. It's just like an opening, right? External auditory meatus, external auditory canal के में भी वो meatus का मतलब वही होता है, ठीक है? So yes, guys, that was regarding the maxilla bone. I personally wanted to know discuss a little bit of this bones, because I will be like again discussing it um, in the upcoming lectures of head and neck. So at least you should know little about the bones, guys, so that once we like go on further with the other parts, so it's like way clear to you, like at least we have talked once about all this. So that was regarding today's lecture. I've given you very brief, a short introduction regarding this. Guys, for doubts, you can just for notes, you can join my Telegram group, right? You can join my Telegram group, that is Docs Mayan. Okay, and you can join my Insta ID for like doubts. That is Abhijeet Kumar 7859. Abhijeet Kumar 7859. Right. I will be starting with, guys, yeah, I will be starting with the skull anatomy soon. Okay, I will be starting with the skull anatomy soon so that we will have something new to learn. Okay, I'll be starting with skull, then I will be talking about the face. I'll be again talking about all these muscles, guys, from where they are coming, from which part. Okay, how much hours is optimum to sleep so to get maximum time to study for exams? Mera 7 to 8 hours is like enough. Sometimes I also sleep 9 to 10 hours, but it's okay. Like you should study at least 7 to 8 hours. 8 hours is like minimum, guys. You have to sleep to take like proper rest. Okay, so yes. Hmm. Any other thing that you would like to address? We'll be discussing it again, because everything will be coming again, guys. So absolutely no need to worry. I will be no starting with the other bones. Yeah, I'll be discussing the other bones in a short, but I will be like focusing on skull anatomy or the scalp anatomy tomorrow. I'll be talking about the scalp anatomy. So yes, thank you guys for your patience, for listening me out. Goodbye.